Hi, my name is Dr. Siegfried, and thanks for coming to my Facebook channel, YouTube channel. Today I'm going to be talking about my chiropractic story. You know, I've been practicing for over 35 years now, and I'm going to break some of the rules today. I got this little script here, and instead of trying to remember it all, I'm going to have a few notes. So hopefully that'll get everything out of my head that I'm trying to talk about, because I think it's really important. And it starts with this. You know, if you're one of the millions of Americans suffering with arthritis, like back pain, neck pain, headache, shoulder, hip, knee, foot pain, digestive upsets, insomnia, anxiety, depression, high blood pressure, etc., you have a lot of questions, and a lot of people are suffering with these things. And a lot of people ask us all the time, can chiropractic care help with these ailments? And the answer is, it depends. We've helped lots of people with these ailments. And over time, some people get more results than others, but it depends on your body. It depends on a lot of things. But we've helped lots of these people with lots of these problems over the years, and that's one of the things I'm sharing with you today. Because my answer is, I don't always know for sure, but it sure has helped me with a lot of these issues. You see, I'm 67 now and counting, and everybody has a story, so here's mine, and it's regarding my health journey. And I'm going to start with my birth, because a lot of people don't realize how valuable chiropractic care can be. You see, when I was born in Nazareth Hospital in Philadelphia, Pennsylvania. And one of the biggest things I've had to struggle with my whole life, and I've become more aware of it as time goes on, is that I was born with a club foot. And I don't know if you've ever seen a club foot, but that's what a club foot is, right there. There's many reasons for it. Some people say it's genetic, some people say it's nutritional. I think it's a combination of both, but the point is, it's something I've had to deal with my whole life. And when I was younger, I didn't realize the effect that it was having on me. Only as time has gone on have I been able to appreciate the fact that it's really caused a lot of issues for me. However, because of chiropractic care, because of nutrition, because of proper exercise, lots of different things, those things in particular, I should say, has really helped me a lot. So I was born in Philly. By the way, go Eagles! They won the Super Bowl last week. I was really happy about that. Born in Philly, and when I was growing up, I played baseball, basketball, and I had sprains, sprained ankles. I was on crutches a couple times. I hurt myself playing football, which I don't recommend anymore. I tried running track, but I couldn't run track because my foot was so screwed up I was just running cockeyed all the time. And in baseball and basketball, I was able to get by, and I played a lot of basketball, a lot of baseball, and my dad always was taking me to the chiropractor, all the time. You know, when I had issues that weren't clearing up, he was always taking me to the chiropractor, and the chiropractor was adjusting my feet, adjusting my back, adjusting my neck, in addition to which my dad always fed us good nutrition. Then when I got to college, I played basketball, had a significant injury, went to the chiropractor for several months because I got low bridge dunking the basketball, and this was in the fall, and then by springtime, the chiropractor had me going again. I was playing ball, pitching, by the way, and I walked on it to college. And then from my undergraduate studies in Emmitsburg, Maryland at Mount St. Mary's College, I went to Schiller University in Heidelberg, Germany. I thought it'd be a great idea to go to Schiller University in Heidelberg, Germany for my junior year abroad project, and I ended up staying there 3.5 years. I played some basketball over there, but I got into rugby. And over there in rugby, I broke my nose, I had a concussion, I ended up with headaches, sinusitis, and I got a lot of help over there from what they call Heilpraktikers, which are somewhat like chiropractors, and they do adjustments of the spine and the extremities and things like that. So he helped me a lot. Not necessarily with my head aches, because the nasal specific is what helped me with that when I came back to the States, but I got a lot of help. Again, the chiropractic care was very helpful to me. And then when I came back to Portland to go to chiropractic college, I played baseball, basketball, was getting regular adjustments as needed, and then I left, went to Italy, and then when I came in 1980, I got my license for chiropractic here in the States, but I had a chance to go practice in Italy with the Italian Olympic team as their chiropractor. So I went there, spent 2 years there, and when I was over there, I was playing baseball, semi-professional baseball with an Army team, came back here, played a lot of baseball and basketball, all the while getting adjustments as needed. And then my regimen, people ask me, well, what do you do? Really what I do is a lot of basic things. I swim, I stretch, I ride a bike, I jog, not as much as I used to because of the difficulty running. I take certain supplements, whole food concentrates, I watch my diet very particularly, I get massages, acupuncture, I do a lot of traction maneuvers to help my spine. And when I do things like that, it takes the pressure off the nerves. And I don't have a picture of my spine right now, but my spine looks like a truck ran over it. And it's got a ton of arthritis in it, and the discs are not what they should be. And it's just a progressive thing. But again, the adjustments, which have helped me over the years, have helped me so that I don't have to take a lot of drugs. Right now, all these people are taking opioids, and there's an opioid epidemic. My opioids are getting adjusted, and my diet, and taking care of myself. And it's a challenge, yes, but the trade-off is, for example, I've been able to pitch semi-professional baseball. I'm 67 years old now, and I've got over 200 victories in the Portland City League. I've been pitching semi-professional baseball since I was in college. So all of these things combined have given my back and neck and feet and ankles and knees and hips issues. However, I've been able to overcome them, stay in the game, so to speak, with regular chiropractic care, watching my diet, whole food concentrates, massage, traction, and all these other things that I provide for my patients. So the question invariably comes up, somebody comes to see me and they say, can you help me? Well, I'd like to think I could help everybody. I can't help everybody. But a lot of the people that I help, we have tremendous results with, and here's how we do it. When you call or when you come in, we always take a history. I need to know your history. I know that you might have a back and a neck pain. I want to know your complete history. Like, for example, mine. If I just walked in and said, hey, my back hurts, I'd say, okay, well, let's get you adjusted and see what we can do. Well, if I know the history, then I have a better idea of a prognosis. When I know the complete history, I have a better idea of the prognosis, what we're in for, particular things that you might need, and we take it from there. So we do the very thorough history. We do a very thorough examination. Do I take x-rays? Absolutely, when necessary, because I got to see what it is I'm working with. Whether it's an ankle like this, or a back, or a neck, or a shoulder, we got to know what we're working with. And the best way to do that is to see what the condition of the bones are, see what the condition of the joints are, because that's a reflection of your diet, of your mechanics, of your past history. So those are the things we look for. Then, what else do we do? Well, basically, if I feel like if I can help you, I say yes, let's get going. We put you on a little program, try to get you. People always want to get out of pain naturally, so that's what we do because we don't use any drugs. We want to get you out of pain naturally. So what we do is we treat you to get you out of the pain as soon as we can, as fast as we can, as best we can for your schedule and your pocketbook, and then we try to maintain the structures, to maintain your health with regular adjustments, watch your diet, whole food supplements, certain home things to do at home. I'm really big on home care. So that's a big part of the program here is home care. We really emphasize that. And so the other thing is this, in the final analysis, we live in an environment that's just so full of chemicals, toxins, the food, the air, the water, all of these things are affecting us daily, tremendously. They're affecting us, basically they're affecting our body and our minds. How do you deal with this stuff? From a standpoint of the structure, chiropractic care is one of the best things you could possibly do. And then at home, you got to watch your diet, make sure you're taking whole food concentrates that are organic, non-GMO'd, untreated, etc. This synthetic industry, which is booming, I think is helping to destroy people's health. We address that issue as well. So the question is, can I help you? You got to give me a call. You got to come in. We got to consult. You got to let me evaluate you and see what we can do. I'm happy to try and help you. That's my passion. That's my mission. And I'd like to meet you someday, and maybe we could start taking care of you and have you enjoy your life better and share the knowledge and my experience with your family as well. Thank you very much for watching.